So I'm a physiotherapist mainly working on the acute wards, and my role with students is basically supervising the acute cardiorespiratory placement. I've had a student in the past whereby I felt that they were compromising the safety of the patient that they were with, and so that usually requires the supervisor to immediately step in because obviously we don't want to endanger our patients either. Every supervisor is different, but I usually like giving them feedback straight away if something sort of happened and we sort of reflect upon it, and then I try and give them formal feedback at the end of the week.
Initially, if we identify with the student that there is a few concerns regarding their performance, I usually try to get them in a quiet place to have a chat with them. So I usually sort of take them off the ward actually, outside that environment so we're not interrupted. I have been sort of liaising with other educators as well to just help me as well help the students. So then we have developed some performance plans for students to follow and work towards some goals, and then we sort of revisit those goals in a week or two to see how they're going with those goals.
One of the things I find, again, having those challenging conversations is to make sure you get your point across. Because often students get a lot of information and they don't retain it. If these challenging conversations are not had, it means that the student's going to go away thinking what they're doing is correct. So I think it's like my responsibility as a clinician to our profession as a physiotherapist to make sure our students are safe, they don't have gaps in knowledge, and if they do on placement we acknowledge those gaps rather than just sort of pass students for the sake of passing them, because at the end of the day someone's going to employ them. So you want to make sure that they're actually a safe clinician to be out independently practicing.
The main thing that I like to sort of impart on the students is their clinical care for patients that they're caring for. So including sort of their psychosocial as well. So sort of sitting down with their patients that they're caring for and speaking to them, I think that's really important. And I usually try and combine both with them. So clinical is really important, but also like the actual total well-being of the patient they're caring for. Because I think if they understand that, then they get a better picture of that patient that they're caring for.
And I think in the last couple of years that I've been supervising, my own skill set has changed, because I think it's great to be a supervisor. You learn how to have challenging conversations, you learn the variability of the students that you're getting as well. So one of the key things to think about as a supervisor is, would I employ this person at the end of the day?
I mean, we all come into nursing for a reason, and that's to care for people and help people. So if there is maybe some, issues or problems with their performance, that I think we need to address them early, because we're all there for usually the same reason, and that's to care for patients and give them the best outcome.